It is the countdown to pink. So we are inching closer to October, Breast Cancer Awareness Month, and we're introducing you to local doctors who are helping women through their journey. Dr. Shada Mihardari is a board-certified plastic and reconstructive surgeon at Crystal Clinic, and I'm so glad and happy to have you with us this morning. Thank you for being here.
Thank you so much for having us.
I think it's so important for women to understand all of the options that are available to them. And that's part of the problem, is they don't always realize the options that are there.
Absolutely. And that's what we want for patients. We want them, when they meet with their breast cancer team and they get this overwhelming news, that they know that they have a team of specialists that are going to provide them with all the information, the resources, the tools they need to make the best decision for them. Because there are a lot of options out there.
And you don't think of it that way. I think they think of traditional just routes that you can go. Now, one in particular is something that you have specialized in. You are very well versed in doing this, and this is the oncoplastic surgery?
Correct.
So what is that?
So oncoplastic is a term that we use to describe treating or removing breast cancer while utilizing some of the techniques and principles we use in plastic surgery to restore and give the best breast shape and form possible.
So technically, when someone has then a lump removed, they might have some kind of area where there's nothing there anymore. They would need it filled in, so to speak.
Correct.
So you are making the breast whole again.
That's a great way to put it, yeah. So traditionally, when a patient has a breast cancer diagnosis, they're going to meet with a team of doctors, and they may be offered what's known as breast conserving surgery. And that essentially is when the breast surgeon performs a lumpectomy, they remove where the tumor is, and they remove a normal margin of tissue around that. Prior to oncoplastics, they may be left with a large defect, a deformity, and when it's paired with radiation, sometimes very asymmetrical breasts. So with oncoplastics, the breast surgeon and the plastic surgeon kind of team together to come up with a reconstructive plan in order to avoid those defects and to preserve the breast shape and form.
And I think, too, it's always important for women to understand that this is something that insurance covers. I think they think, oh, well, if I'm adding something like that or they're adjusting something, then I might have to pay out of pocket for that part.
100%, yeah. It's kind of heartbreaking because patients come into the office and the last thing that they always walk out and they're like, is this going to be covered? And that's just not something that should even be on their mind. But it's a federal mandate that breast reconstruction surgery is covered, and that includes contralateral procedures that we do for symmetry.
Meaning, so if the other side that's not affected, you could still adjust that so to make sure that they are
Yeah, and it's
even.
not uncommon that when we're doing the surgery together with the breast surgeon may be operating on the side with the cancer, and the plastic surgeon may be doing a symmetry procedure on the other side to either lift or reduce that breast so that when the patient comes out of the operating room, they're more symmetrical.
And who would be a good candidate for this then? Anyone who?
You know, well, first and foremost, the breast surgeon helps decide if they're a breast conserving candidate. Mm-hmm. Traditionally speaking, some of the best candidates are those women with larger breasts who have symptoms of what we call macromastia, or neck, back, shoulder pain related to the size of their breasts. And perhaps they were thinking about having a breast reduction surgery, or maybe it wasn't even on their radar. This might be one of those surgeries where they can have both done at the same time. Now, that's not to say that small-breasted women are not candidates. It's really kind of a case-by-case basis, and so this is where we encourage patients to meet with their plastic surgeon and their breast surgeon to see if it's a potential possibility.
And how do they get in touch with you then? If they have gone through surgery and they want some reconstructive help, do they just call? Can they just get it easily? Do they have to have a referral to get to the Crystal Clinic?
Yeah, usually just a referral, but they can call, and we get patients in very quickly because we know we're on a timeline and we need to get this done. But come in for a consult just to talk and decide if this is a potential option for them.
It's so important to just know all of the options that are out there, as we're saying, and it's always important to celebrate too. And so I know we're gearing up for our big pink runway again, happening on Wednesday, October 23rd this year. It's been an honor to be a part of this pink runway for a few years now, and to see the smiling faces of the lives that you and the other doctors have changed is honestly one of the most rewarding things I get to do all year. So we hope that we see you there. You can go to their website for more information and to get tickets and be a part of this. It's always a beautiful event. I'm sure you would agree. I mean, it's just
Absolutely.
spectacular.
Love it. We hope to see you guys there.
Thank you so much for coming in today and for sharing your knowledge.
Thank you for having us.